Well, good morning, everybody, or good afternoon. My name is Rob Walker, and I'm an epidemiologist and a data scientist with the Iowa Department of Public Health. I'm part of the Environmental Services Bureau, where I manage the Environmental Public Health Tracking Grant, and essentially we have a data portal that brings in both environmental and health data together in a single place. The CDC National Tracking Program has 26 funded tracking programs, including Iowa, throughout the United States, and many have developed a portal with just the required functionality. Our department has taken this concept one step further and developed a larger department-wide approach to the tracking portal. And as I was preparing this, I was told yesterday that I needed to say something about myself, who I am. And so a few personal things. Well, first of all, my wife and I are foodies. And so we've been enjoying eating our way across this town because the food is just amazing. And also, I wanted to say something about our education. So my undergrad degree is actually in animal science. I was a domestic animal biology major. Then I transitioned and got a master's in health service administration. And finally, I'm ABD with my doctorate in biostatistics. And so my education is all over the place. In fact, my first job in public health was a disease investigator. So my job was to go out there and find everyone who tested positive for a sexually transmitted disease, convince them to give me all of their partners, and then go get them and their partner treated, and then go get the partners from the partner. And so when they said, "Hey, Rob, would you come up there and give a presentation?" I was like, "You're not going to be nervous, are you?" I said, "If I can do that job, I can do any job in the world." And so here we are today. Additionally, I'm the national co-chair of the CDC Security Network and Development Work Group. And this group focuses on the security, the infrastructure, and the software and the geospatial development of the portals nationwide that the network is built off of. Today, I'd like to talk to you about how we took an aging data center with end-of-the-life software and revitalized it through using AWS and Tableau, and show you some of the value-added bonuses we have gained through the Tableau experience. As required by the CDC for any publication, this was created as part of the IDPH grant and funding. However, I do not represent the official position of the Centers for Disease Control and Prevention. Now I won't get in trouble. Today, we will explore the history of the tracking grant and define what our requirements were, what the infrastructure was originally built on the portal, and now what we've upgraded to. Then look into the process this transformation took. Finally, I will reveal what our future plans are with Tableau and examples of what we have done so far in our first year in both Tableau and AWS. We'll dive into some of the risks, challenges, and benefits that came out of the journey. So first off, what is environmental public health tracking? Tracking is the ongoing collection, integration, analysis, interpretation, and dissemination of data on environmental hazards, exposure to those hazards, and health effects that may be related to the exposures. The goal of tracking is to provide information that can be used to plan, apply, and evaluate actions and prevent and control environmentally related diseases. In 2000, the Pew Environmental Health Commission detailed an environmental health gap, which is basically a lack of basic information needed to document the links between environmental exposures and those diseases. The following year, Congress funded the tracking program through the CDC. A quote from Thomas Burke of Johns Hopkins summed up direction to this report. "We can track the flu, West Nile virus, and mad cow disease, but not enough of the chronic illnesses that are the biggest killers of Americans, because we just don't have enough of that basic information." So this is how my first grant meetings really felt like. How do we manage and display all of this big data that we have? Iowa was funded in 2010 for the Environmental Public Health Tracking Grant through the CDC. This was originally a 5-year grant, but we were funded in year 2 and required to complete all of the work, the 5 years worth of work, in only 4 years. We launched our portal in 2013 after 37 months, 1 month shy of our 36-month goal. We went with SharePoint as our platform and Performance Point as our visualization tool with a mix of Excel and reporting services. IDPH was a Microsoft shop at the time, so we really had no choice of what to use. But one of the biggest limitations we had was all our data had to be developed in cubes for consumption within Performance Point. We were refunded in 2014 for a 3-year cycle to maintain the portal, and then during this time we did a major improvement in functionality. Even when we launched the portal, we already knew that our time was limited in using Performance Point, as the end of life had already been planned by Microsoft. Additionally, we were informed that our internal data center, which is in the basement of our building built in 1952, had a 2 to 5 years worth of life left. This was due to Executive Order 20 of 2009 that required statewide IT consolidation and limits the ability of our department to replace key IT infrastructure. We had multiple layers of redundancy that were slowly failing, and we were unable to replace the infrastructure. The new 2017 funding cycle was for 5 years and is focused on expanding the current portal, especially in the sub-county and near real-time data. To have a better understanding today of what the path we chose, here are some of the grant requirements that we were required to have. Number one, we had to present the data in maps, graphs, charts, and tables, and all that had to be downloaded. Not only were certain data mandatory, but also the content around that data to explain the topic area and why it's being published. In case someone wanted to reproduce our visualizations, we had to have detailed metadata to show. And public health uses highly confidential data, such as cancer, birth defects, hospitalization, and emergency room visits. So we had to ensure that that data was aggregated and suppressed at the appropriate level for security and confidentiality. We had to build a dynamic query system to generate the visualizations with the ability to have both counts and rates in temporal or spatial dimensions. All of this was to be presented on a public portal. Actually, I called the CDC and said, hey, can I have a site full of PDFs? Because technically that would work, but we had a resounding no, and so we actually had to do all the build. Both the CDC and state regulations require 508 accessibility compliance with color contrast with screen readers. So this is what our original landing page looked like on our portal that we launched in 2013. As you can see, we had a menu across the top, hover over, drop-down list. It met all of the CDC requirements. This is the portal's dashboard that we had a drop-down selector for the year, multiple selectors for county. The dashboards were found to be very difficult for the general public and local health organizations to understand. Look at all the arrows, the numbers, the abbreviations. It was just actually really confusing. A major limitation of SharePoint for the portal was the inability to add any text boxes or help, as everything is built on a grid. So this is how I felt during our original build process. And after the initial launch, as I heard the complaints, I saw the issues, I knew the problems, but I really didn't have a way to resolve them. The portal met all the CDC requirements, but it just wasn't user-friendly. So here's another quote that came out of the Pew report. We were providing the data, but the tool was not sufficient to help our stakeholders identify, prevent, or deal with the threats. During the 2016 portal facelift, IDPH began the process of exploring alternative options for the portal. We knew that Performance Point had an end-of-life roadmap already been published by Microsoft, and this combined with the aging data center meant that a plan needed to be developed in the next 2 to 3 years, and a cloud-based system was looking more feasible for a long-term solution. In 2016, our information management staff began a detailed search for potential BI solutions. Needed to work with our current data structure, could be managed by our IM staff, and provide at least the minimal portal requirements that we mentioned earlier. 5 solutions were reviewed. We could stay with Microsoft and transition to BI. or we can move to Tableau, Amazon QuickSight, Google Data Studio, or IBM Cognos. In 2017, it was decided to explore Tableau closer because on paper, it just looked like a better fit for our organization. And now it was time for us to conduct a full review. IDPH started with 15 copies of desktop Tableau. The tracking program connected to all the existing data sources for the original portal, which were the cubes, and we developed a proof of concept of all 98 dashboards. Our current department website is built in .NET Nuke or DNN content management system and is hosted on AWS. So we use that platform to recreate a full demo of one topic area with content, data, and visualizations to ensure that Tableau and DNN would fulfill all of our requirements. So remember when I told you that our IM told me I had 2 to 3 years to come up with a new solution, which there was, 18 to 30 months was left? Well, in the third quarter of 2017, we were told that that value had changed. I had 6 to 8 months that I had to be out of the data center. So I had to be out by May of 2018. Apparently, the air conditioner was failing, and once it goes, the entire data center was going to go down. So I had no choice. I had to get everything out of the data center. So this meant I had to plan and develop for an entirely new portal solution, while in tandem, our department was facilitating moving everything to the cloud, which they've already been planning for the last 18 months or so. So we rushed out, purchased Tableau server subscription because I really wanted a standard annual cost for budgeting purposes. We split the price between the tracking program and the department. And because we already created all those visualizations in Tableau, we just went ahead and connected to the newly developed Tableau data sources in server. We produced extracts, and those were generated and moved to the public side server. And we partnered with the University of Iowa to conduct a clear language review of all of our content, along with our subject matter experts for all the additional content. The tracking program populated the web pages in DNN with both content visualizations, and the new revitalized portal was launched in May of 2018 after 7 months of work, much less than the 24 months it took to build the original portal. So here's how we've designed our servers. We have our IDPH server behind a firewall, currently in our data center in the basement, supposed to be moved very soon. And this is where we do all our visualization creating and connect to all of the data sets. We have our external public-facing server where we push all the extracts and make them available on the public portal. That's currently loaded in AWS. The extracts ensure that we have complete security and confidentiality, and the data is also suppressed. Again, all this will be in AWS very soon. The portal was launched, and we're getting great results from user feedback. As with any online publication, we continue to tweak and improve through our user comments. During the past year, I've also been working with our Tableau Success Manager to develop a roadmap for Tableau so we can measure our improvements. We're using various qualitative and quantitative evaluation techniques to show the benefits of going to Tableau. This includes return on investment, FTE savings, error reduction, data modeling, and content analysis. Training and development of a community practice within our organization was also one of our key priorities. We were hoping for some really good benefits from going to Tableau. We actually got them and a whole lot more. We've already seen a reduction in staff time. I went from funding 1 full FTE in information management to only funding a half FTE for the tracking. And this is with an increase in the number of data sets being loaded annually. Typically, they load 2 to 3 new data sets a year. I'm uploading 2 new data sets a quarter with only half the time. Programs can change the portal without lengthy business requirement documents. It went from weeks to hours to make those changes. I don't have to go to information management and say, hey, I need these changes. Well, I need a BRD. Fill out everything I need. They make the change. They do it wrong. I have to go back and redo the BRD, make sure it's right. Now I can do it myself. Data can be more dynamic. I'm no longer restrained to cubes, and it's easier to join these data sets together. And data suppression can actually be done inside Tableau instead of having to do an external script. We can respond to emergencies and publish needed data quickly for responders or the general public. For example, if we have a flood, I have the location of every well in the state. I can provide that to the local environmental service people, and we can go and we can test and treat those wells immediately after the flood recedes. Our end users are much happier. Creating maps are much easier. Anyone here use ArcGIS? I probably saved at least 80 hours over the past year. I do all my maps straight out of Tableau instead of using ArcGIS. And return on investment. Over 4,000 hours have been saved by me in the last year for our department. This equates to 2 full FTEs along with my current workload. I suggest to programs that I assist in the department to use this time savings to improve your data, explore new data, or dive into the new aspects of data that you've never been able to use before. And the focus of IDPH is to use Tableau to enhance the data usage, not supplement or replace employees. While we're working in the portal, the process to complete migration was ongoing. And this is sometimes how our information management felt during the research phase. The AWS migration has been progressing prior to and during the portal rebuild. We loaded the public Tableau server into AWS, the same location as our DNN for our website and the portal from the beginning, so we wouldn't have to migrate it at a later date. As a side note, during this time, our department also went from an Outlook-based email system to Google email. This included migrating all of the department, division, bureau, and individual drives to Google Drive. The pre-migration planning phase continued to move ahead for almost 2 years, conducting an application inventory and correcting any problems. The application inventory was used to determine what would be migrated and the status of those applications. The first step was for our program managers to work with all the bureaus and to identify what applications were actually in our department. Some of these weren't currently managed by information management, as they're either small, legacy, or federal applications made for a very specific purpose and may be housed either in the bureau or a division drive. Around 50 applications were identified as needing to be inventoried and reviewed, and our tech team and team leads reviewed the applications and rated them as a simple red, yellow, or green code. Red designated applications that would need to be upgraded prior to migration because there was just too many incompatibilities. An example was Attednees. This is a DOS-based application built in the mid-'80s that requires a Windows 7 box to run. Or water treatment devices where our information management is having to build a new database from scratch because the other one requires a Windows 2003 to run. An example, yellow indicated applications that would be best if updated but could be supported in AWS. An example would be Toxicol, which would be the poison control database. The back end was actually in Access, but there was an option to upgrade this to SQL, so we upgraded. The application went from yellow to green. And of course, green indicates an application that's ready to be migrated. The next chapter of migration was to conduct an independent review of the data and servers and the applications by what we call a service agent software. This process examined the application, determined the memory usage, processor needs, and the input-output requirements. The software provided the reports to our information management, and they used this to group the applications and databases into migration groups. The process progressed far enough that we decided that we needed a contractor. So IDPH used a state-approved preferred vendor to speed up the process. The first step of the evaluation of the entire system and to map everything. And the contractors took 2 to 3 months to do this. And this led to the planning and development of sprints of around 6 months. A challenge of using an outside service is a difference in communication styles and the lack of historical knowledge of your system. Oftentimes, our contractors try to mansplain our own system to us, or sometimes they treat us like we had no idea what we were doing. Now that we're in the deployment step, and it consists of about 9 phases of moving and set up infrastructure to be deployed and tested, and then going into various levels of production from highest to lowest level priority. Now that we're in the deployment phase, the continued use of the contractors may end up winding down as our IDPH team is well trained, and we think that they can carry the migration to the finish line. The same process can be done in Azure or any cloud service, but we chose AWS because, one, our OCIO directed us that's what we're going to use, and also we can lean on AWS to give us some really good quick guidance. And the reason why the OCIO directed us is because AWS provided us with Certified Criminal Justice Information Services, or CJIS, compliant security for certain data. Just like building a house, the first and the most important phase is the implementation of your foundation. This consisted of your domain controllers, infrastructure, networking, and security. The initial foundation was the biggest challenge and by far was the most important. It is the one chance you have in your organization to start from scratch and learn from all your past mistakes. As with all the phases, this went through development, then test, and finally went into production. After the foundation was completed, the following phases are grouped by apps that had things in common, such as similar networking, connections, or structure, and these were all identified during the service agent review. First on the list is the Tableau internal server and the data center where all the hospitalization, birth, death, census, and all our other data is stored because these are the highest priority. These are the foundation of the 26 data connections that feed the 242 workbooks and 964 views that make up the public health tracking portal. Along with Tableau connection, the data marts are also used by programs because we connect SAS, SQL, SPSS, or R to conduct various data analysis and statistical calculations. The Iowa Disease Surveillance System, our Healthy Homes and Lead Poisoning Surveillance System, and the Rhapsody Electronic Lab Reporting Systems are all going to be next to be migrated. And of course, the rest of the applications in the department will be migrated based on a level of high to low priority. Even though we've been using Tableau for over a year now, we purchased the on-site server Rapid Start and are having Tableau come in to assist us in migrating the Tableau server currently housed in the internal data center to AWS, where the public server is being housed. They'll actually be in Iowa starting on Monday to complete this phase. The migration will be more of a reinstall into AWS environment to better align both the public and private servers. We feel that the AWS expertise and the excellent customer service from Tableau will assist us in ensuring that we have a solid disaster recovery plan and that our server is configured to be optimized for the new environment in AWS and provide any hints or tips on server maintenance or our daily operations. IDPH used a mix of Gartner's 5 ways to migrate applications to the cloud. These were based on the need and the availability. If the service is available in AWS, we're going to try to use that existing service. If not, we're going to look for a third-party application that can perform the service that we need. And if that's not available, we'll maintain the application ourselves, but we'd rather not. We're just excited to consolidate all of the individual servers we've been maintaining in the past. We're going from multiple independent servers to consolidated servers with similar specs that will handle multiple applications. And we're migrating a total of around 11 terabytes of information. The Iowa Department of Public Health collects and stores massive amounts of confidential public health data. Our data consists of birth and death records, disease investigations, including all those STIs, all the immunization records. We have data on all of your hospitalizations and emergency room visits. We have data on licenses such as doctors, nurses, beauticians, plumbers. We have the location of all the licensed radioactive material in the state. This data might include date of birth, social security number, names, addresses, diseases, reason you went to the hospital, the reason you were discharged from the hospital, and even the payment information that was used at the hospital. The concern was how to handle all this information in the cloud. So by moving to AWS, we will incorporate continuous scans of all of our data to try to identify any public health information that was missed. All our data will either be encrypted within the app or be stored on the Gov side of AWS in our CEDARS certified server. So what's gone well so far? The first success is our previous experience in AWS and migration. We've already migrated our website in SQL from our data center to AWS. The decision of moving to Tableau and away from SharePoint and Performance Point was one of the pivotal points in this overall process. And we also migrated Tableau from one AWS server on the West Coast to a new one in Indiana. We do have 5 staff that have been involved in all aspects of the process of migration and have been going to trainings for about the last 2 years. And they're well prepared to complete the migration journey. After the initial training, they actually set up a box in AWS, and they used it as what we call a play period sandbox. This was a pay-to-play process because you have to purchase the server space and access, but our team really felt that this was invaluable. You can work, delete, start over, and you can practice and test different concepts that you're interested in working with. A takeaway about this is make sure you turn your server off when it's not in use because you're paying for it. For example, we shut it off on the weekends to save our department a little bit of money. One of the key successes of moving to the cloud is the absence of downtime. Not having to maintain physical machines, ensuring the cooling systems actually work, and having to reboot your servers. All of this saves time and money. Not having to replace infrastructure allows for better budgeting. If every 2 to 3 years you're having a huge increase in cost because of hardware replacement, it's really, really difficult to budget and plan, especially on government funding in which we're usually funded flat from year to year. What would we do differently? We would have started earlier. Even though we had 2 years of planning, seems like a lot, our guys always say they would like to spend a little more time with certain items. The process has been moving at the speed of government. Our contracts take time, multiple layers of approval, constrained by the policies and procedures of OCIO. If you've ever worked in government, it just takes time. And we'd like to have better communication. Better communication with our OCIO, better communication with our contractors, with AWS, with Tableau, and even with the people within our department to make sure everyone is on the same page and we're all moving together, forward together. A few things to take away from our experience in migrating data and applications to the cloud and AWS is start your planning early and make sure you involve all your required staff from the beginning. Conduct a comprehensive inventory and ensure all applications and data will survive your migration. And don't be scared to start from scratch. Build the infrastructure for the future of your organization, not what you have right now. So, who would like to see a few of our Tableau examples? I'll demonstrate a few of our value-added examples and end with a walkthrough of the Iowa tracking portal that we talked about earlier. So a SurveyMonkey was conducted by our Bureau of Emergency and Trauma Services to all 727 emergency medical services in Iowa. 699 of those services actually responded to the 60-question survey, and it had a data footprint of 699 rows by 189 columns of data. I used the Tableau data prep process outlined by Steve Wexler of Data Revelations to make the data tall and narrow instead of short and fat. The data needed to be displayed by the state, all 99 counties, and all 12 service areas. If you've not already used or looked at his work, he has some really, really great resources. I suggest you look at that. The program originally tried to do the work themselves. They used Excel and PowerPoint, and this process took them 33 hours to complete just one county's worth of data analysis. So my boss's boss came to me and said, I need this stuff and I need it last week. What can you do? So after I completed the analysis and visualizations in Tableau, it's estimated that the return on investment in saved staff time was approximately 3,300 hours, or 1.65 FTE. After adding salary, fringe, and indirect costs, and subtracting my salary, the overall savings was $295,000. And not only was there staff time savings, the project was completed in 20 business days instead of the estimated 400 business days that it was going to take the program. The visualizations were completed to look like a single-page report so they could easily be PDF'd and provided to the customers. I developed this lead risk model using the census tract level American Community Survey data for poverty for children under age 5 and below, housing built prior to 1950, and language spoken in the home not being English. The census tract data was provided through an API to give us the shapefiles. The final model was validated using a regression analysis of about 500,000 child-led tests over a 10-year period by census tract. The model has a 65% predictive value and will be published November 6th to allow physicians, community services, and local health organizations target children at the highest risk of lead poisoning in specific communities to provide additional services and testing for them. It provides a simple 3-level, high, moderate, or low designation. The Iowa Lead Poisoning Prevention Program actually using this model as a centerpiece for the supplemental funding work that started October 1st. And they'll develop videos, marketing, training, and education around the model and use it as a focus for their primary prevention. Basically, what we're wanting to do is prevent a child from ever being lead poisoned in the first place instead of waiting after they get tested and then treat them at that time. Prior to Tableau, we've never been able to use and publish census tract data easily. We've only used countywide data. And lessons learned, census tract IDs are not unique. You need to add the state ID, the county FIPS, and then the census tract ID for it to be unique. I've actually had to load the data twice in Tableau because we didn't know that. One way to information management is using Tableau is to provide a detailed review of all the help desk tickets. With this is helping them assess the ticket type the department are requesting the most and assess the time it takes to service those people and the number of days to close the ticket. The value of this knowledge is huge, as resources can be reassigned quickly to provide coverage in areas as it's needed. They're also using dashboards to track the ordering of assets and the distribution of those assets to people within the department. There's another dashboard that actually tracks the warranty of our laptops and provides a report to identify all the assets that need to be replaced. Again, all that was originally being done in Excel and wasn't being done very well. So with that, I'm actually going to switch over and we're going to do a live demo of the portal. The Iowa Public Health Tracking Portal serves as a centralized resource for public health data. Our key audiences are the general public, local public health agencies, and policy and decision makers. We've structured this on what we call the bite, snack, meal concept, where data are provided at different levels of complexity to meet the varying audience needs. In general, data on the portal is updated on an annual basis. We do use the IDPH data standards where possible, and we suppress all the data at counts at 5 and below. New topic areas are typically published each quarter. Our public health tracking portal strategies are improved public health decision making by taking advantage of the high quality accessible data and decision support tools. Healthier Iowans in healthier communities. Using the data to perform thorough community needs assessments and to create and implement impactful health improvement plans. Improved opportunities for funding. Use the data to support grant applications and ensure the secured funds are used in programs to provide the most value to Iowans. And last is better use of time and resources. Spend less time searching for the data and more time using the data for your projects. Much of the data on the portal is presented as nationally consistent data measures, or NCDMs. The use of using NCDMs to report data makes it possible to compare from county to county, or from Iowa to any of the other 25 grantee states in the tracking network. So with this is our landing page. Data within the portal have been broken down into content areas, and each of these content areas are located under one of the 6 navigation menu items. The top navigation across the top, it expands into the content areas when you hover over them. And of course, at the bottom, we have our National Tracking Program link. They pay me, so I make sure we have a link to their project. We have the portal updates. This is a way for people can subscribe to our listserv, so they get an update every quarter on what's new on the portal. And again, we have a first-time user button. You click it, and you actually go to our first-time user page, where it gives information about the portal, gives where everything's at. It also has our news and updates. So this is where, for example, this week is Lead Awareness Week. And then, of course, training. And what we've had a contractor from the University of Iowa, and we've created simple videos on difficult information, such as suppressed data, age-adjusted rates, or confidence intervals. And this is a way to help educate people who just don't understand those difficult terms. So as we go into the content areas, for example, asthma in Iowa, as you see, we have an infographic. This is what we call our bite. My wife is actually our communications person. She calls this clickbait. This is what we can export this. Our local public health can use this in campaigns. They can put this directly on Facebook and drive people to their program and give them just a little bit of information. And oftentimes, this is the only information someone's looking for. As you can see, we have content. Asthma in Iowa. This is what we're talking about when we talk about asthma in Iowa, or asthma in the environment. So this is the content that says why this data is important on our portal. We have a left navigation, and as you can see, we have both hospitalization and emergency room visit data. At the top, this is where we have our measures. If you see, there's some of these things are highlighted in yellow. The reason why I have that, you click on it, it's actually our glossary. So these are the terms. We did what we call clear language review. And our University of Iowa, they looked at it and said, here's a list of all the words that a common person is going to have no idea what it means. And so what we did, we brought those in, and we made them glossary terms to help the reader understand. And last but not least, we've embedded our Tableau object directly onto our website. Unlike our dashboards in SharePoint, we couldn't have all that text around it. We couldn't have help menus. This little easy thing says hover over a county to see. You can hover over, and now you can get that information. But that simple help wasn't available on the old portal. Simple things like that Tableau is allowing us to do, it's bringing twice as many people to the portal. And because what they do, they come to the portal before, they're like, this thing is too difficult, I'm out of here, I'm going to find my data somewhere else. Now they come to it and say, hey, this isn't so scary, not so hard, and they keep coming back. And that's what we want, is continued users to come back. So we're going to click on, let's say, PowerSheet. Interesting thing, On our old, if anyone here used cubes for SharePoint? Cubes are very difficult. One thing we could never do, we can never have state and county rates at the same place because cubes just don't allow that. And so now, the way our data is set up, we can have state and county side by side so you can have that direct comparison. So if we go to the next column, rate by age group. And what we have here is now I can actually do trend lines. As you can see, Power Chic, they're actually below the state average on 2 to 4-year-olds. But the next 3 categories, they're above the state average. It's an easy way for local public health to bring that information and say, here's our problem in our county. This is what we need to address. And of course, you see the 65 plus, it is suppressed, and that's how we, so there would be 5 or less in that category. And all these, from the map in the first couple, these are what we call our snack. A little bit of information, easy to look at, but as you go through, the data gets more and more difficult to understand as you go through. And finally, you get to the back, and we actually have our data tables. And this is what we call our meal. These are people who want to create their own visualizations. And so we provide that for them. And just like anything else in Tableau, you can go down to the bottom, and again, we can download this information as an image, the data, a crosstab, or of course a PDF, and to meet the CDC requirement. So with that, I'll leave you with a few pieces of advice today. Take time and do your homework when planning a software change or transition to the cloud service. Utilize your customer service manager to assist in promoting Tableau throughout your organization. And never underestimate the value-added benefits of Tableau or AWS. Even if you have a plan for using Tableau, example, we purchased Tableau just to put the portal up. Think outside the box on additional ways that Tableau can be used within your organization to simplify, enhance, or automate your processes. And with that, any questions? Yes, sir.
Yeah, you mentioned that you had a bunch of FTE savings and you recommended using those savings for data improvement rather than just reassigning them. Can you talk a little bit more about what sort of data improvement?
You bet. So, any public health nationwide, we do a great job of gathering data. We have tons and tons of data. But there's not a lot of people who's actually looking at the data and saying, is it quality data? Is it clean data? Is there anything wrong with the data? And so that's what the savings I have for information management is they're actually building our visualizations. So what would have to happen is they would build it in Performance Point. I would look at it and said, no, you did it wrong. So they'd go ahead and rebuild it again until it got it the way I want it. I got them out of the picture, and I create the visualizations myself. And so I want them to do their job, which is manage data and put those data connections together. Give me access to more data so I or my program can do more work. So that's the true savings I want them to do, is give me those data connections. But on the project side, we have a bunch of data standards in the department, and I really strive to them say, let's use Tableau. You can bring that data up. Let's do scatter plots. Let's do histograms. Let's look at this data and say, where are these outliers? And then, where's that outliers coming from? For example, I manage all the lead data. I go and pull this data in. I look at it and I said, there's about 2% of all the lead tests come in have no result. So what happened was, during the electronic lab import, somehow they're putting it in the wrong place in the HL7 file. Our program never even knew about these because it doesn't signal a case. So now I can go back to that laboratory or have the program go to the laboratory and say, you need to put this in this spot because we need those results. And that's the type of data you can look at is they've never looked at that type of information before. But now they can evaluate it and improve the quality of the data And with that improved quality data, now I can give that to the decision makers so they can make better decisions on how programs should advance. Make sense? Okay. Yes, sir. I have not, and probably won't affect us at all. Well, first of all, I don't know if you know, public health agencies don't have to comply with HIPAA. We are HIPAA, what's the term? HIPAA waived. That doesn't mean we just can give our data out whoever we want. We have strict laws that prohibit certain things. And so we don't fall within HIPAA, but that's why we chose AWS, because it's CGIS certified. We're very adamant about our data security. I won't even give data to another program within our department without some type of written agreement. I'll give aggregated data, but no one's seeing data unless you have a public health reason to see that, and that I have to have that justified. And so, yeah, even interagency, we don't share it unless we have a need. And everything is encrypted, secured. In fact, where's my jump drive? I have to have an encrypted jump drive even to bring this presentation here. I can't use a normal jump drive. I mean, that's how secure we keep everything. Yes, sir.
Yeah, you talked a little bit about challenges. One of them was around government and how things move slowly.
Yes, sir.
And there's barriers to change.
Yes.
Talk a little bit more about that and how you broke this down.
Well, and that's why it's taken 2 years. For a lot of organizations, probably can be done a lot quicker. One thing we do is you jump through a lot of hoops, and you shake a lot of hands, you do a lot of nodding, and occasionally you ask forgiveness and not permission. And but for the most part, what you do is you see the policy, you see the procedure, and you sit down with your team and say, what can we do? Or how can we stay in the gray but not go in the red? And that's just what you do. It's an obstacle course. There's no straight line. Our migration also, we do things one step at a time. A way of thinking about this is a meal. So we cook our green beans. We pick them, we cook them, and then we eat it. And then we go over here and we're going to make our salad. So, I mean, we go from start to stop for each piece, whereas a lot of organizations can probably do a lot of their migration at one time. And so we do that deliberately because we have to have a continuity of service. And so, for example, our Tableau server. We want to make sure that that's put up, everything's running, because we don't want to go and we can't shut down the Department of Public Health and move everything over a weekend. We have to have service. So we do things one at a time, and again, that takes a little bit longer. But for the most part, you just have to be very creative. You think outside the box, what can we get away with? And oftentimes, before you ask permission or ask what you're going to do, have a way that you know you want to resolve it. Because oftentimes you go into a meeting, how can we do this? The higher-ups, well, I'm not sure. I said, well, have you ever thought about this? And so you can feed them some of the ideas, and then they come like, hey, that's a great idea. Then ultimately, it makes it look like they made the decision, but actually you fed it to them. I mean, it's interpersonal skills, which sometimes it's very difficult among IT. They're not usually the easiest people to talk to. And so you just have to work through that. Any other questions? Yes, sir. Yes. To be honest with you, I don't know. All I know is our OCIO said we're using AWS, and that is the reason why, and I take their word for it. I assume all of the main, Azure and all of them, they're going to have, because if they want government business, they have to have that CGIS compliance. Anything that has Social Security number or license number must be in a CGIS compliant server or space. And so I'm sure they all have some type, but you can actually ask Azure, they actually have a booth. I just ask them, hey, do you guys have that? I'm sure they can give you an answer just like that. Yes, sir.
I think on an earlier slide, it looked like you deployed Tableau server to AWS, and I'm just curious where you guys managing all of your data doing that in AWS.
Yep. So right now, all of our data, and until Monday, all of our data and our internal Tableau server, which that's where we use all of our desktop license and Interactor, that's where we connect to it. That's all behind our firewall in our basement. But it'll actually be in AWS starting next week. And so that's where we do all of our data connections, and that's where we do all our visualizations. Then what we do is we do extracts, and I upload those extracts to the public server, and that keeps, there's no way anyone can ever hack into our public server and get to my data, because there's a clear line difference. There's just no connection. Yep. And so right now, it's literally lift and put those visualizations up there. Luckily, those extracts are only updated once a year, and so it's pretty easy. And so it's just a matter each quarter, we go, these are the ones that need to be updated. Boom. Our plan is whenever we move to AWS, each quarter, because once you move it, the data connection is going to be broken, and so you have to fix them all. There's what, 300 of them or so? We're going to fix those data connections as each quarter rolls around that we're time to update. So we're going to space that out over the course of a year. But even if we wanted to, it'd probably take a couple hours. You can actually do it all. It's pretty simple. And to actually move Tableau server from the West Coast to Indiana, all we did, we backed it up and restored. And it took less than an hour, and we moved our entire server over. So it's pretty seamless. Yes, ma'am. Oh, I track everything. Are you talking about on the public side, the portal? We have, actually, I use Google Analytics and used to call it PWIC. They've sold or something. So I actually have 2 web analytics. And so I'm able to track, technically it tracks IP addresses, but I don't get that far. I look at the state they're from, what county they're from, what type of computer they're on, and I can take from the IP address, I can see, is it a government organization or local public health? So I can get a basis on who's using it. On the internal side, I know everything that's being looked at, and when they looked at it, and how long they looked at it, and should they have been looking at it. You know, we have all that. And part of the CDC requirement is we have to submit our web analytics to the CDC once a year. And so we compile all that up. You know, what is the most viewed and what's the least viewed, and that way we can justify, should we get rid of this national consistent data measure? No one's looking at it, so why are we keeping it? Or here's an area that people love and they really, really like, we should expand this and put more NCDMs in. Any other questions? IT-wise or in program-wise? Or both? Front end, me and another guy. And so we build all of the dashboards, and so we maintain those and we update those. My wife, she does a lot of the review and the content-wise. We're data nerds, and so we're not English teachers, and so we make sure that I spell everything right, and punctuation is not my friend, and so all that's done correctly. But yeah, the 2 of us, we build those out. And so that's part of our grant. We do that, but at the same time, we do value-added services. I work with other programs to help not only what's on this side, but in fact, I'll show you a quick example. So legislators, they went and they legalized fireworks 2 years ago. So now we can blow our fingers off if we want to. So we were getting tons and tons of information from news agencies and legislators. What's going on? Has there been an increase in injuries? So after about the 10th person who called, we're like, why don't we just put this on the portal and then go look at it themselves? Before we went to Tableau, when we were in Performance Point, this would have been a 6-month process. You write your BRD, you get your data, you create your measures, you get with them. They don't necessarily do it the way you want it to. You have them redo it. Then you test and everything. Well, we were able to get this put up in about 2 weeks. And so with this, we're able to say, hey, here's all the measures with fireworks. And let's see if I can have the time trend. And needless to say, yes, fireworks injuries are directly related to legalizing fireworks in Iowa. And this is a way that the news agencies and the legislators can use this to do their job. We don't advocate for anything. I can't say this is good or bad. What I can do is I can provide the data to policymakers for them to make those decisions for the state. But yeah, 2 of us, and we probably spend half our time working in Tableau, half of it doing other programmatic work. Any other questions? Well, thank you guys. If you need anything else, just let me know.